Hi, I am going to talk about disorders of fluids and electrolytes by Vasopressin antagonists. Definition: ample evidence is available to implicate vasopressin (ADH), a small polypeptide that is synthesized in the hypothalamus and secreted from the posterior pituitary, in the pathogenesis of most hyponatremic disorders. As the most common electrolyte disorder, hyponatremia is consistently associated with increased mortality and morbidity. Advantages: the treatment of hyponatremia has been plagued by a paucity of controlled studies and by a lack of reliable and safe approaches. Therefore, the regulatory approval of vasopressin antagonists represents a milestone in the field.
Testosterone system is a classic endocrine system that helps to regulate long-term blood pressure and extracellular volume in the body. The system begins with the release of angiotensinogen into circulation by the liver. This may be in response to low blood pressure and adverse changes in sodium concentrations. An enzyme, renin, is secreted which cleaves angiotensinogen to form the inactive decapeptide angiotensin 1. Further transformation of angiotensin is carried out by angiotensin-converting enzyme, or ACE. This is predominantly found in the pulmonary circulation. However, ACE is also produced in the vascular endothelium of many tissues, including the kidney, adrenal gland, brain, and heart. The angiotensin-converting enzyme converts the inactive precursor angiotensin 1 into the vasoactive peptide angiotensin 2. In addition, alternative pathways exist that do not rely on either renin or ACE. In non-renin pathways, enzymes like tonin and cathepsin D release angiotensin 1 from angiotensinogen and tissue plasminogen activator, or TPA, and can make angiotensin 2 directly from angiotensinogen. This bypasses the midway production of angiotensin 1. Enzymes like chymase can
Mechanisms of action: the stable expression of vasopressin receptors in cell lines has allowed for the study of their molecular mechanisms. Vasopressin binds a superficial site where areas the antagonist penetrates deeply into the membrane, altering the ability of the agonist to bind to the receptor in the adjacent loop. This inhibition culminates in the prevention of the insertion of water channels into the apical membrane, which thereby inhibits the reabsorption of water and the regeneration of concentrated urine. Cyclic AMP, which is implicated in the growth of renal cysts, fluid secretions, and cell proliferation, is a target for the treatment of adult polycystic kidney disease. Tolvaptan has not been garnered approval for the treatment of this disorder from the Food and Drug Administration (FDA).
angiotensin-converting enzyme also degrades bradykinin, which is required for synthesis of a major vasodilator, nitric oxide. Angiotensin 2 binds AT1 receptors expressed on the surface of vascular endothelium and impairs nitric oxide synthesis as well. Reduced bioavailability of nitric oxide combined with the stimulation of AT1 receptors on smooth muscle cells causes vasoconstriction. In addition to a vasoconstriction effect, stimulation of AT1 receptor causes the adrenal glands to release the hormone aldosterone, resulting in sodium retention. Combined with vasoconstriction, this increases blood pressure. In the final stages of RAS, the kidney reduces the production of renin. Most of the known actions of angiotensin 2 are mediated through the AT1 receptors, which can be found in the kidney, heart, vascular smooth muscle cells, brain, adrenal glands, platelets, adipocytes, and the placenta. Angiotensin II type 2 receptors can be found in low levels mainly in the uterus, adrenal, central nervous system, heart, and kidney. AT2 receptors appear to counteract the effects of AT1 receptor stimulation. Another angiotensin II type receptor is the AT4 receptor. Its stimulation may increase synthesis of the natural inhibitor of TPA called PI1, thereby reducing effective fibrinolysis. Stimulation of AT4 receptor appears also to promote cell growth and proliferation.
Disadvantages. Vasopressin is contraindicated in people allergic to the hormone. The drug should not be used in patients with vascular diseases, especially for coronary patients. Constrictor effects due to their small dose of vasopressin can cause angina, pain, and higher doses can trigger a heart attack. Vasopressin may produce water intoxication manifested by dizziness, apathy, and headaches, which can lead to convulsions and terminal coma.
To do an activity well, the tissues of the body need enough amount of fluid. 60% of the human body consists of fluid, and the body always loses fluid in many activities. To keep the fluid balance, the fluid loss must be replaced by the intake of fluid. Fluid intake is mostly through consumption of beverage, which contributes 60% of water to the body, or 1500 milliliters each day. To get enough water, we need to drink approximately 8 glasses each day. Although food does not carry water as much as the beverage, it can carry 30% of water to the body, or around 700 milliliters. Metabolism produces 10% of water in the body, or around 200 milliliters. When the body lacks fluid, a receptor in the hypothalamus sends the impulse to the posterior hypophysis gland to release the antidiuretic hormone. Antidiuretic hormone, which enters the kidney, gives the information to the glomerulus to absorb more water. When the water
Issue applied in Ecuador. Vasopressin is used in conventional medicine for the prevention and treatment of post-operative abdominal distension, in diabetes insipidus, and in preventing the formation of soft shadows on abdominal radula. Also, it is important to keep the normal water balance.
First up, antidiuretic hormone under normal conditions. We have antidiuretic hormone in green, we have water in blue, and red blood cells in red. As pictured here, we have the brain and the spinal cord, we have the kidney, and we also have the bladder. Now, in the brain, underneath this segment here, we have the posterior pituitary gland, as pictured. So we can see it properly. Now, the posterior pituitary gland is an extension of the neurohypophysis, which is actually a part of the hypothalamus, and it injects or secretes ADH into the blood vessels. The antidiuretic hormone then travels through the bloodstream and is pumped around the body until it reaches the kidneys.
Conclusion. The advent of the use of vasopressin antagonists has provided physicians with a new means of increasing the plasma sodium level in patients with hyponatremia. These agents appear to offer substantial advantages over previously available therapies that have been shown to have limited efficacy and unacceptable side effect profile, or both. To ascertain whether such increases in the plasma sodium level have an effect on mortality and morbidity associated with hyponatremia is a challenge for the next decade.